listener. So what we are supposed to study in this is how to manage common injuries and their management. So this is a very detailed presentation. It will be showing some of the major first aid situation and major emergencies and what are the possible first aids. So to begin with, we will go into what is a emergency. The last class we have been discussing about what is an emergency and what are the important principles in emergency care, because there are certain basic rules in emergency. These are some of the basic rules. One, don't think that you can manage it yourself. Even if you are the only person, immediately call somebody for help, and meanwhile you take care of the patient. Then second aspect is that bring help to the victim. That is also an important principle in first aid management. And third one is take the ABC: airway, breathing, etc. These are then do not cause further harm. That is another important principle of first aid, because if you don't handle the patient in the proper way, that will cause more physical injuries or bodily injuries, because if you are wrongly taking the patient or wrongly holding the patient, that itself is a reason for more injuries. So there is another principle: do not cause further harm. Now we will be going into what are the important situation. Normally these are the important and situation. One is you have to evaluate the scene, what kind of situation that you are going to handle, then assess the safety of the patient as well as yourself, then which we have already told in the last class. Then prioritize care, then check for any kind of medical. For example, some people may need more care, specialized care. Do head to toe check, closely examine the patient from its head to toe, so that you can find out any kind of injury, sprain or bleeding, etc. Move the patient only if it is necessary. That is another important thing. That is why I told you earlier, do not cause further harm. That is an important principle in APC care. Now these are some of the important things. Now we will go to our main topic, that is, this is the topic common injuries and their management. Now you are seeing a patient and you see that there is no breathing in that patient. So one important thing is administering CPR, cardiopulmonary resuscitation. That is a full form of CPR. So this is how the CPR are normally given. It is a kind of chest compression. You can see that the patient is holding like this, so that we won't give too much pressure. That is why they ask you to hold the hand like this. So in order to prevent too much pressure, but still getting the enough compression, this is the technical way of giving the chest compression. And CPR, this is an important thing, because sometimes heart may stop beating. Sometimes some kind of mechanical shaking or mechanical vibration can trigger the heart to restart again. Just like a car engine can sometimes restart by pulling the car for some time. The same thing happens here also. You are applying some mechanical shock, mechanical pressure that will help the patient to recover fast. So this is an idea of how we are giving CPR. So CPR is a very important technique if you find that the person is unconscious and person is not breathing well. Then here also you can see that if chest compression is not working, then next thing you can do is that if you can give some kind of breathing. See, open the nose, open the mouth of the patient, close the nose. Otherwise what happens, whatever air you are breathing will be coming out through the nose. So hold on the nose and breathe into the mouth and blow into the mouth. That is what is suggested in the case of patient is totally unconscious. So these are some of the important techniques you can do if you find a person is not breathing and unconscious. Then this we can do. That is one important thing is that before you see the you go for that, immediately call someone like ambulance or emergency number. Then meanwhile you attend the patient. For example, if you are having, put the phone in the speaker mode and listen to the suggestion they are giving. Same time you also have to care. So this is the way. That one important thing in any emergency is be stable, be calm, and this is where most of the people fail. Most of the people get scared, get panicked. They may cry. They may don't know how to react, especially if it is some very close relative. You may be totally worried. You don't know how to handle the situation. Then another situation is the case of bleeding. Here you know that these are some of the basic things that we are doing. Here you can see that the first and most important thing is stopping the blood flow. So what we normally do, we press on the site of injury or site of bleeding, so that very little blood, we are actually mechanically stopping the blood from coming out. So by applying some pressure, we can prevent the blood from leaking out, because loss of blood can lead to many other complications. So we have to minimize that. The person is losing only little amount of blood. So stop the flow of blood. Then you can wear gloves. For example, if your gloves are available, because sometimes if you touch with a bare hand, if some germs are there, that can enter through the wound. That is why they ask you to wear the gloves. Then cover the wound. So that is an important thing. Covering the wound prevent blood from leaking out. That is one way. Another is that it will also prevent the entry of germs into the wound. So that is the two advantages of covering the wound. Then apply pressure. Everybody is doing that. If there is some injury, we will be pressing on that part of the injury, so that very little blood will be coming out. And normally the clotting time is 5 to 10 minutes. So if we hold like that, after 10 minutes, the blood will clot. If it is a small injury. But if it is a major damage, major injury, you have to use some kind of bandage or plastering, something we have to do. Apply pressure. If a body part has been amputated, put it on ice. Because advantage of keeping it is on ice is that ice will reduce the decay, I mean spoiling of the cells. Because if it is in the ice, there are a lot of enzymes in our cell. So ice will be lowering the temperature of that body part, so that enzymatic damage of the cell. Because normally what happens is that there are two different ways by which any meat product, whether animal or other type of meat, are decayed. One by the action of bacteria. Second by the action of our own enzyme. So that is known as enzymatic degradation. So when we put it in an ice, our enzymes won't be damaged, so that very little enzymatic degradation will be taking place. Sometimes, for example, a finger or a part of hand, if that is cut, you just put it in the ice, take it to the hospital. Sometimes that itself may take 2-3 hours, sometimes more than 4 hours. So if you are keeping it in the ice, doctor may be able to fix that part again. There are a lot of hospitals in Kerala, like they have plastic surgeon, they may be able to fix it properly, only if the part is in a good condition. Then shock is another situation. In the case of shock, you can see that what we are doing in the case of shock is that the person may be normally unconscious if it is a severe electrical shock. So in the case of electrical, because our brain and our body is working in a DC current, very minute DC current. And if there is an external current source entering our body, that will be changing the electrical pattern of our body, and that will make the patient most of the time unconscious. So lay the victim down, that is the first step. Then one important thing is that if it is from a wire, we have to make sure that the contact with the wire is removed. That is another thing. Then cover with a blanket, because most of the time and that will be a person with electrical shock will be having a kind of his body will be very cold, so he will be losing a lot of heat from the body. So to prevent that, we have to cover the patient with a blanket, and you can also do something like that, raise the feet of the person so that maximum blood will be flowing to the heart. So that is the purpose of raising the feet of the person. So that is what we can do in the use of a shock, electrical shock. Then another is the case of anaphylactic shock. Anaphylactic means actually very severe level of allergy, very extreme level of allergy is known as an anaphylactic shock. Sometimes you might have read in newspaper that the stinging of a honeybee or stinging of an ant has caused the death of a person. Some people are highly allergic, too much allergic. Even a bite of an ant or bite of a honeybee, bite of a wasp or bite of a spider may trigger very extreme form of allergic reaction, and that will be leading to anaphylactic shock, later heart attack and death. So in such a case, give the victim medication. If any medicines are available which has been prescribed for him, we have to give it immediately. Call for help as soon as possible. That is one important thing. Then start CPR. Now you know what is a CPR. Here you can see that people are doing the CPR, cardiopulmonary resuscitation. And check a CAB, chest compression, chest airway, and finally breathing. These are the two important things. Chest compression, check airway, and finally breathing are some of the important things that you can do in the use of an anaphylactic shock. As act fast, as an anaphylactic shock that is unattended can lead to death of the victim within an hour. So in most of these cases, you are not going to get a lot of time. Only in a few minutes or few hours may be available. So that is why in any emergency, it is the common sense of the person that makes the difference between life and death. If you act with in a wise manner, most of the time you can avoid a complication like death. Then heart attack, you can see that nowadays a lot of people are dying from heart attack. See, in the case of a heart attack, one is if we have to first call the ambulance, so that, and meanwhile you can attend the patient. So that is called emergency number. Because if you call the 112, that is emergency number, it is a centralized system. So they have all the resources so that they will be immediately checking which ambulance or which team is available in your location, and they will send you the nearest ambulance which is free. So that is one advantage of calling the emergency number. Then making the victim comfortable. I know a case of one of my friend. What happened with him is that he had an heart attack, and the relatives took him to the hospital, in one hospital in Cochin. And when they reached the hospital, doctor saying that he had an heart attack, they told that take him to the ICU as soon as possible. Hearing that, he got another heart attack and he died there itself. So this is an important thing. Keeping the victim comfortable is an important thing in any management of heart attack. So if some people are very much scared of heart attack, snake bite and other thing, if you tell that you have been bitten by a poisonous snake, then it is finished. He may immediately have another attack. So one important thing is that act wisely, act and use your common sense. So even if it is a dangerous situation, if the patient sees that everybody is stable, everybody is calm, then he or she may feel that things are not so complicated, I may recover. On the other hand, if he or she is feeling that it is a dangerous situation, his or her tension will be increasing, adrenaline release will be there, and that may make the survival more difficult. Then make the victim comfortable is the first step. Loosen tight clothing. If just you can unbutton the shirt or other things, so that the person may get a lot of air, and his here. That is one way of dealing with that situation. Check for medication. If you are any, for example, most of the heart patients, may have some medicines available in their home. If it is necessary, give it. Then keep the victim still. So this is most important thing in heart care management or heart attack management is act wisely, keep the patient in a comfortable. Don't give any stimulant, that is not advisable. Give aspirin. If aspirin is available, that is one way. Because aspirin reduces blood clotting, thus helping maintaining blood flow through a narrowed artery. So that is the advantage of giving aspirin. If aspirin is available at home, because most of the time this heart attack may be caused by some kind of blood clot in either a blood vessel going to heart or in another major blood vessel. So when you are giving aspirin, that aspirin may be able to reduce the blood clotting to some extent, and meanwhile you can take the patient to the hospital. So these are some of the important things which you can do in case of a heart attack. So here this is another very dangerous situation. Many people don't know how to handle this situation. Choking. When something is blocking the pharynx. Sometimes small babies will be taking some balls, sometimes some food particle, and that may get stuck in the pharynx. So that the baby may not be able to breathe. So this is very important, is that ask the person to speak louder or cough, so that sometimes so next thing is regarding, you have to ask the patient to cough. So cough may help to so that the other object may come out. Another thing that you can do, if that is not working, deliver 5 black bad blows on the back of the person. Just tap like this, little harder. On the back of the person, you can give 5 blows, hard slapping. Then if that also is not working, put the hand like this and press on the abdomen. So pressing, perform an abdominal thrust. Just press up on the abdomen very deeply. At the same time, give the back blows and repeat this for several times, so that most of the time this object will come out. So that is the only thing you can do. But the problem is that you will get only 5 or 10 minutes. Within 5 or 10 minutes, death can happen. So that is the problem of choking. If you don't know what to do in such a situation, it will be a very dangerous situation, because brain cells may die within 5 to 10 minutes. So that is the problem of. So this is it's a very simple thing, but if we act wisely, act with the confidence that you can serve the patient, it normally works. So this is the abdominal thrust and back blows are the technique used for this talking. Then if abdominal thrust don't work, this is what you can do, because in all this situation you have to immediately call the emergency number, and you should do that. Always, we have to put the phone, even if only one person is there, put the phone in the speaker mode and talk to the emergency people, and meanwhile you should give that. So abdominal, then check air ABC, perform CPR if there is no breathing. So these are some of the things that if you see here, they can fingers you. If there is some plucker or the other thing, and you can just open the mouth if it is possible to take it using a plucker or other thing, try for that. So these are some of the important techniques that you can do, because this is something a person in the family or person nearby has to do. No other person can, because if you are not getting too much time. Then electrical shock, we have discussed earlier, but still this is again some other points. See, don't touch the patient. First you turn off the power, then call, here this is an American slide, call emergency number, then remove the person from live wire. That's an important thing. Then check for breathing. If breathing is okay, you can be half relieved. So these are some of them. You can also here earlier also we had seen that some other techniques were also used in electrical shock. Then eye injuries is another technique, another kind of emergency. So if there is any kind of eye injury, splashing with the water. That is first thing. If any particle is entering the eye, because don't try to take it immediately, because sometimes when we are taking it, it may cause more damage. Then blow to the eye. Then cuts near the eye. These are some of the different types of eye injuries. Sometimes penetrating objects may enter into the eye. Then, so these are some of the things only a doctor can handle it properly. What is important is that you take the patient in a careful way to the nearest eye hospital. They only can do that. Then burns are there. There are different levels of burns. One is that here you can see that first degree burns are there, second degree burns are there, then third degree burns are there. In the case of first degree burns, for example, a small drop of wax particle fell on your hand. That will cause you reddening. That is a first degree burn. It is not a deeper burn, but you feel very pain on that part. Second degree burn means there will be blistering, bubble-like formation will be there. That is known as a blistering. And third degree burn means skin cells has been damaged severely by heat and fire. And there will be charring of body tissue, deep tissue damage. So the survival of the patient depends on how much is the damage the patient has had. So sometimes in your paper you might have read that the 40% burns. That is 40% of the skin cell has been damaged. If it is more than 40% of the skin cell, the recovery chances are very less. So based on that, you'll be having an idea of how much damage the burns have caused to that patient. So that is first degree, second degree and third degree burns. Then you can see the exposure to hazardous material. Here, like eyes can be affected, skin can be affected, inhalation of gases or ingestion or feeding or eating of some dangerous poisonous material. These are the situations where we are exposed to hazardous material. And in all such situations, most of the time, if it is a poisonous chemical, sometimes we need to give some kind of antidote. So sometimes it may be poisonous gases like carbon monoxide. Then we have to take him to the hospital immediately. Sometimes some kind of poisonous gases or poisonous chemicals might have entered your eyes. So all these will be creating a lot of difficult situation which you cannot handle at your home. The best thing is to call for emergency help and take the patient to the hospital at the earliest. Then broken bones. So this is another situation where most of the time we are come across in our family or other places. See, in the case of a broken bones, most of the time it comes from a falling from some higher areas. And in such a situation, if the bones have been broken, there is compound fracture. Then bones have been broken at multiple places. If only a simple fracture like a small break, a small cut here, then it doesn't cause much problem. But if there are multiple fractures, we call it as compound fracture, we have to handle the patient in a careful way using a stretcher or something. Otherwise, that will be causing more harm. So one important principle of accident care is do not cause further harm. So that is an important thing. So handle the patient very carefully. If the person is having any kind of anaphylactic shock, we have to give him the CPR or other emergency breathing. Then heat exhaustion. This is also common during the summer season. Move the patient to a cool place, then lay the victim down, elevate the feet, loosen clothing, then give fluid, plenty of fluid. Sometimes people may not be aware that the body is having getting into too much heat. So one important thing is that give the patient too much fluid, give a cool compressor. There are cool wipes are there. So pressing those cool wipes on the head and other important parts of the body can immediately reduce the core temperature of the body, because the heat exhaustion and sometimes in paper they will show sunstroke, and that happens during summer season. In April, May months it is also common in our state also. So if the temperature is exceeding 40 degree in our state, our body, we are not used to handle such situation, and many people, those who don't take enough water and those who work in open sun, under the open sun, can have this kind of problem. Then another thing is heat stroke. In the case of heat stroke, call immediately 9. Here it is 112. Then cool the person down. That's an important thing. Then monitor the situation very carefully. So heat stroke, and here in both cases it is somewhat similar. The main idea in heat stroke or heat exhaustion is that keep the patient calm, loosen the clothing, give him plenty of fluid, and apply some kind of cool compressors or cool wipes. Then next is fainting. In case of fainting, you can see that what we can do is that we have to check for breathing, and if breathing is not there, we have to give him artificial breathing. Then administer CPR. That is, if the person is not conscious, these are the only two things you can give him: blow into the mouth, give him CPR. So these are the only thing you can do if the patient is unconscious. Then call if more than. Then if conscious, lay the victim down with the feet elevated. The purpose is to bring maximum blood to the heart region. So that is the central heart and the brain. That is the purpose of elevating the feet. Then epileptic seizure. Now epileptic seizure normally happens when electrical pattern of your brain. As I told you earlier, our brain is working with a minute electricity. Okay, and then that electrical pattern is changed or altered. That will be creating a lot of problem for the patient. And in epilepsy or in epileptic patient, when a situation of a seizure may be happening, and in Malayalam we call it as chudali. That is but nowadays it is very rare because most of the people take precautionary medicine. Earlier it used to be more common. Now remove the victim from hazard, check for breathing, then check the mouth of the patient that nothing is there in the mouth. You can see that in this epilepsy, he or she may be moving the legs and arms violently. If it is in a classroom or other thing, and if there are desks or benches are there, please remove it so that his body part may not be damaged. So this is one thing. Then we can also open the mouth, and we see that there is now the tongue is not damaged by biting. Sometimes earlier people used to say that give him some object like iron to hand hold. That is not a solution actually. What is actually the reality is that this seizure may not last more than 10 minutes. So even if you are giving a iron nail or iron keychain to hold, after 10 minutes the patient may recover, and the people who have given him may say that it is because of I have given him the iron. So it is not like that. There is no such thing. This will not last normally 5-10 minutes or 15 minutes. That is a normal time. So the only thing you can do is that keep the patient comfortable, make sure that he is not biting his tongue, then he is not moving the legs and arms violently, and after that give him enough care. That is the only thing you can do, because most of the time after that 15 or 20 minutes he will be perfectly okay. So this is a short time, and this is happening because of electrical imbalance in the brain. So this is an idea of how we can handle different type of emergencies. And some of the emergencies we can handle ourselves at home. Some of the emergencies we may require the assistance of professional team. Then one important lesson we must understand is that in every first aid care, our attitude is important. If we are calm, if we are confident, if we are acting wisely, we can make a difference between life and death. So most of the time, if you are scared, you will not be able to give first aid in the proper way.